I was just going to demonstrate two methods in which we diagnose cranial cruciate ligament disease. One is called a tibial thrust, and what this test is doing is it's recreating weight-bearing forces that go across the knee. In a dog that has an intact cranial cruciate ligament, the knee should be very stable. Without the cranial cruciate ligament there, for example a tear or a partial tear, we'll see the forces being demonstrated in a thrust. So we're demonstrating here a tibial thrust. So as weight goes across the joint, the ligament's not there, so the distal femur pushes on the tibia, therefore moving it forward. That causes pain and also traps the meniscus in there and causes injury to that. The other test that's used to diagnose cranial cruciate ligament tears is a cranial drawer. And here we're just physically putting the knee through a range of motion which the ligament should prevent. And if it's torn, you'll see we can physically manipulate the knee. In a dog that has an intact ligament, this would be impossible to do. So using those two tests, your veterinarian can determine whether your dog has a torn cranial cruciate ligament. So this dog just had a tibial-plateau-leveling osteotomy, which is a surgical procedure that changes the forces in the knee to get or to eliminate tibial thrust. If you've seen the other videos on what tibial thrust is, I just want to demonstrate that, again, reenacting weight bearing on the knee here, we're not getting any tibial thrust, which therefore you no longer need a cranial cruciate ligament. The weight is just distributed across the knee and there's no instability, and this dog should do really well.